Second oral question, the Lord Bishop of Gloucester.
I beg leave to ask the question standing in my name on the order paper.
The Government acknowledges the possible link between advertising, body image and mental health, including the potential harm such a link may cause. The Government intends to use the online advertising programme consultation, which closed on the 8th of June, to develop the evidence base on this issue. Our priority is to ensure that any intervention is evidence-based and makes a real and positive difference, and the Government will set out the exact approach having assessed the evidence.
My Lords, with my Identity campaign, I've spoken to many young people about their worth not coming from how they look. In the other place, the Prime Minister assured the Honourable Member for Bosworth, Dr Luke Evans, that he would look at a body image initiative as part of the mental health plan. Given that Norway has recently introduced a retouched images law, can the Noble Lord the Minister say what assessment the Government has made about the potential merits of labelling digitally altered body images used for commercial purposes?
Well, I should pay tribute to the Right Reverend Prelate and the campaign that the Right Reverend Prelate has been involved in on this. It is an important issue and we're still learning a lot. As the Right Reverend Prelate rightly says, Norway is about to introduce it. France and Israel have introduced it in the past. Sadly, the evidence coming from those studies is limited at the moment as to their effectiveness. There's also a debate within within people who look at this, whether you should be stopping those images in the first place rather than allowing altered images and then putting a warning. What's the most effective way? And we need to see more evidence.
Brinton, remote contribution.
My Lords, the 2021 Children's Society Good Childhood Report shows that 1 in 7 girls and 1 in 8 boys are particularly unhappy about their appearance. Young people who are not happy with their lives at 14 are more likely than others to have symptoms of mental health issues by 17, including instances of self-harm and suicide attempts. Despite the government's promises of future funding for mental health support for schools and CAMS, it's clear that young people are not getting that initial frontline support that they need now. So how soon will there be mental health counsellors in every secondary school?
One of the things when you look at the area of children and mental health, but also the fact of body image, it varies amongst age groups, but also within age groups. And at the moment, we've identified poor body image or concerns about poor body image as a risk factor that leads to mental health conditions, but it's not necessarily a mental health condition in itself. What we have to look at is how much of this already was present in the playground, before the dates of social media, people being called nicknames for their appearance. But it's been amplified now by social media, and we are looking and working with social media companies and others to find the most effective solution.
Could my noble friend tell the House what assessment...
My Lords, I thank the Noble Lord for giving way. My Lords, despite the fact that advertising prescription-only medicines like botulinum toxin to the general public is already illegal, Botox is still widely advertised online by providers of cosmetic procedures. Given the risks of amateur and poor procedures to physical and mental health, what steps will government take to improve the enforcement of existing rules so that the online environment is free of these illegal adverts?
One of the issues that's looked at in the online advertising programme has been a range of issues, including the advertising, including social media, including where people get their messages from in the first place, and then the most effective way. What do we ban? What do we give advice on? What do we give warnings to? And it's an incredibly complicated issue, but what we're looking at is we're looking through lots of evidence that came in as a result of the consultation.
My Lords, what assessment has Her Majesty's Government made of the link between body images, obesity, childhood obesity, diabetes, cancer and early death?
Well, my noble friend asks me a very concise question, which requires a less than concise answer. But all I will say is that clearly there is a link. We understand the link between obesity and type 2 diabetes, for example. But one of the difficult things in this area, is, as with much in healthcare, is getting the right balance. The more emphasis we put on tackling obesity, the unintended consequences that it affects people who have eating disorders. And we now see that in restaurants now and out-of-home places, you have calorie labelling, but some charities that work with people with eating disorders are concerned that that may have a negative impact on people with eating disorders. It's always a difficult balance, and we've got to try and achieve that.
Lords, since the Noble Lord and others have raised the issue of social media in this area, What assessment has he made, or does he know of the influence of social influencers in this area, particularly where they are supported by commercial deals, where certain kinds of advertising are part of what they're paid to promote?
Well, the Noble Baroness makes a really important point about the a contributing factor to people having poor body image. And we do know that there are influencers who promote certain products. We do know that quite often influencers alter their own image to almost an idealistic image, whatever that means, and then young people feel inadequate by looking at that. But we also have to recognise it's not just young people, it's people across a range, even older people. It might be as gentle as a comb-over, but if that makes them feel better, great. But we have to look at this issue in its entirety. I know as part of the online advertising programme, this is one of the issues that's been looked at.
Is the Minister... I'm sorry.
Could my noble friend tell me what the government would do in trying to look at reducing or banning lightening creams, because amongst the South Asian and black community, we do have an issue around a push for lightening creams, and it does affect the well-being of a lot of young people who desperately want to fit in.
Well, if I have been accurately briefed, can I begin by wishing my noble friend a very happy birthday? Yeah. Now I've forgotten the question. It's a really important issue, and it's about ethnic minorities and people with different colours. First of all, young people want to see people who look like them on TV and in the media, so as role models, but just to show they're an everyday part of society. But there's also, within certain ethnic groups, and I'm sure my noble friend will be aware, sadly there is this issue of colorism, where there sometimes is a preference for people within certain ethnic minorities of a lighter colour, and people who are darker with it quite often discriminated or not necessarily abused, but there's a preference for lighter colours. This is all being looked at, and I think what my noble friend says shows what an incredibly complicated area this is. It's really important we look at all these issues. Is it size? Is it appearance? Is it colour?
Minister,
early intervention is crucial. Treatment for mental health conditions such as eating disorders have consistently unacceptable waiting times. At the end of last year, a record 2,100 children and young people were waiting for treatment, with demand continuing to rise. So can the Noble Lord the Minister tell your Lordship's House when the waiting times will mean timely intervention? And what is the government doing to recruit, retain and train the necessary levels of staffing to be able to provide the treatment that's so desperately needed?
Well, I hope Noble Baroness will recognise that before the pandemic, we were actually meeting the targets for many of the younger people on waiting times. Clearly, as with many things in our health and social care service, the pandemic has had a huge impact, not only on delaying people who should have had treatment before the pandemic, but actually increasing the number of people seeking help on mental health issues. As I'm sure Noble Lords will recognise, for young people, those 2 years were a massive proportion of their life compared to us, and those are lost years for them. And it has led to many mental health issues. As the Noble Baroness will know, we have announced the draft mental health bill. The NHS long-term plan will have an additional £2.3 billion a year for mental services by 2023-24, and there will be an extra 2 million people able to access support. This will all take time, and we have to work through that.
Lords,
Thank you. Noble Lords have been rightly criticising advertising and promoting unrealistic body image, but the government itself isn't helping. In April last year, the Women and Equalities Committee published a report on body image saying the government's own obesity strategy actually contributes to eating disorders and mental ill health. The Minister is nodding, so in the interest of brevity, I'll just ask him, does he agree with the recommendations of this committee, and can he tell the House what the government is doing to remedy its approach?
Well, I'm sure the Noble Baroness will acknowledge that many Noble Lords and many people in society want to do something about obesity and healthy eating. But I think this demonstrates what a complex area this is. And what we have to always be aware of any policy positions are unintended consequences. And what we've got to be very careful about is the impact on people with eating disorders, but also the interventions, do they actually work in the first place? and do they lead to more unintended consequences rather than positive results? One example is the calorie labelling on menus, for example. We know there are concerns from from eating disorder charities. At the same time, we don't know whether the evidence is whether it will help reduce obesity, and we need to wait for that evidence to come through.